Hi, everyone. This is Cynthia Hammer. I'm here with another session, and I'm really eager to learn about this because it's a kind of therapy I had never heard of, but it is really supposed to be helpful with children with ADHD. So I'm happy to introduce you today to Dr. Sabrina Stutz, who is a PCIT, which stands for Parent Child Interaction Therapist. Sabrina, thanks for being here. And the first question I want to ask you is, what is parent child interaction therapy? And how is it different from the parenting approaches most families are used to?
Yeah, it's a good question. And I think the best way that I can describe it is in a metaphor that a lot of parenting approaches take a parent and give skills. They teach different skills for different types of child behavior. And the parent is then often on their own to apply those skills in real life at home. But PCIT is different. PCIT teaches parents the skills and then offers live in the moment on the field coaching in order for parents to be able to apply those skills while they're playing and interacting with their child. So you have the therapist in your ear in using a little headphone or a headset, being able to coach you through, let's try this skill. Oh, that didn't work for your child, or here's what's happening when your child's doing that. Great job trying this other skill. Maybe we need to come up with a different problem solution for this particular behavior. And so it allows the therapist to be another set of eyes and ears using some of these skills specifically for some of the concerns that come up in child behavior and in child ADHD too.
So the parent is being recorded, being live streamed on a computer, and you're watching the interaction and you're commenting on it in the parent's ear. Is that right?
Yeah. So when this therapy was developed in the 1970s by a psychologist named Sheila Iberg, and when it was initially started all the way up until around like 2015, this was done in the office, but it was done in an observation room. So the parents and the children would be in the room together, and the therapist would be outside in the observation room looking through a two-way mirror and doing the coaching. So the therapist was never
I've
in the
heard of
room.
that. Yeah, I've heard of that.
Yes. Yes. And so now I do all of my work virtually, and we have really good data and randomized control trials to support that PCIT is just as effective when done virtually. The way that we do it virtually is that a parent is at home with a video camera, either through their laptop or an iPad or sometimes a cell phone, and then uses their own headphones in order to have the therapist from anywhere be able to provide that coaching. So if you were, for example, doing PCIT, I would have you set up your camera, your laptop, set up some toys to play with your child.
Uh,
And then I would shut off my camera so I'm not distracting to the child. And it operates as if it's a virtual observation window. You can hear me through your headset, but the child is just playing with you.
and it just sounds so immediate and on the spot, and so many times people aren't able to transfer their learning to the actual event when it's happening, but this is like a second learning on the spot, learning what you've practicing what you've learned.
Yes, that's exactly right. So parents are getting a lot of really specific live feedback. And we're then able to have another set of eyes and ears to be able to problem solve when the right thing doesn't work in that moment. So we can try backup plans too.
Huh. So, can you give a quick example of what it would look like in a real parent-child interaction? I think we just went through that, what that was like, but it's set up that you have a time that you're going to be sitting there with your child and doing something, and you know the therapist will be there to help guide you through that interaction.
That's right. So before the coaching sessions, just the parent and the therapist meet to go over all the kinds of skills so that we're using all of the same language in PCIT. And then we set up those coaching sessions where parents are prepared with the types of toys to set out, the type of environment that's going to be helpful. They set up their camera, and just like a regular therapy session, we check in for a little bit and then immediately go into parent playing with child, getting live coaching on those skills.
So, do you feel like this coaching works differently when you're working with girls that have ADHD? Do you see any difference?
I don't know that I have good research to support the difference, but I can tell you anecdotally that, and when your audience knows that girls with ADHD present differently
Yeah.
oftentimes than boys
Yes.
with ADHD. And so oftentimes when we are interpreting behavior, we are looking for what might be happening with a child. So I think that's one of the most powerful things about PCIT with girls, especially when ADHD is a concern, is that parents oftentimes don't know, is my child ignoring me? Are they paying attention? Are they having a difficulty with shifting or with hyper focus? Or are they just blowing me off? And all of those different things would require a different skill set for the parent to be able to connect with their child. Having another set of eyes and ears to be able to help you identify that and troubleshoot, trial and error, what works to whittle down, okay, this behavior really needs some sensory input in order to get them more engaged. Or this behavior seems like more of a hyper focus. Why don't we try to meet that interest and see if we can help move them along into whatever behavior that the parents are hoping to achieve, like getting your shoes on to go to the dentist or moving on and starting homework.
Yeah, I know I relate to that. When I was raising my son, my husband and I spent a lot of time wondering what he was capable of because there's so many mixed signals, and to have someone else there helping you to interpret that, no, you're not expecting too much at this moment, or yes, you are expecting too much at this moment. So, what kinds of behaviors do you see parents often misinterpreting with their daughters?
I one of them is the non-response. If we are asking we parents, if parents are asking a question or if parents are trying to gain information from their child or gain connection with their child in some way through asking them to do something or telling them to do something or demanding interaction at certain points, the non-response from the child, especially a girl when ADHD involved is I think one of the main behaviors that requires some interpretation. Sometimes the child is ignoring you because they don't care about what you have to say and they'd rather keep doing what they're doing and they're doing it consciously and intentionally. And oftentimes that's not the case, or oftentimes there's a hyper focus element, or we think maybe they didn't actually hear you. And any of those interpretations requires a different touch. And I think that's what's nice about PCIT is that we're able to actually see from the outside what that looks like. I think the other thing, Cynthia, is that for parents are not robots. They go into these interactions with a whole history with their child. And if your child isn't responding to you in the way you'd like, oftentimes parents get a little bit of fight or flight increase. And so being able to have another person help read the situation and feed back to you what you're doing well, what's working, and also what blind spots there might be and what might be missing has been, I think, the changing point for a lot of parents who think they're operating in certain ways, maybe think that they're collecting all of the data, but might be missing some pieces because they're humans and they bring their own processing and biases into the interaction.
That brings up a question for me is how does the therapist do that with the parent? If you have the girl not responding, do you have, I'll try this and then I'll try that and I'll try that? Or how do you make your guess for what's the first best thing to try?
Sure. Before we even go about trying anything, there's a set of skills that we're trying to get parents to achieve because we know that those skills create closer interactions, better bonding, more attention on their own, even without asking the child to do anything. And so we're working with parents on approaching the interaction through those set of skills. So, to answer your question, some of the things that we teach in those set of skills are reducing the amount of questions we're asking, reducing any kind of criticisms, reducing some of the commands that we're giving. And that on its own
Yes.
reduces a lot of the intentional ignoring that we might see in a parent child interaction.
Yeah, because as you describe that, it just feels like the girl could be overwhelmed. And
Yeah.
sometimes less information is better.
Yes. And we are also teaching some skills that we want parents to be able to include, like describing what a child's doing. That one is the best that I've seen for kids with ADHD, but I think in particular girls with ADHD. If a child's quiet and they're intent in their focus or in hyper focus, commenting on what's going on serves a lot of different purposes. Number one, it's allowing the child to know that what they're doing is okay with you, that you approve of it, that there's tacit approval of just who they are in that moment. So let's pretend Sally is building something with Legos or with Magnetiles. And the parent might be sitting next to them. We'd want them to say something like, oh, you're putting the blue one on next. You're trying to figure out where the next piece goes. Oh, I see you thinking really intently about this. You're picking up the red one. That doesn't fit. Good idea trying to fit something else. And so even if a child's not talking to you, you're connecting with them on what they're doing.
Right, it sounds like you're commenting and complimenting combined.
Yes. So there's definitely praise involved as one of our additional skills. And I think in particular, some of that describing also helps serve as like an external verbal mediation for kids who have ADHD. So we know that helps if kids are having some focus differences. For example, maybe Sally is building her magnetile tower and she's getting frustrated because it's not going the way that she would like it
Yeah.
to.
Uh-huh.
But we might adjust that as offering some verbal mediation through our descriptions, like, oh, you're putting that blue one on next. Nothing is working. That is so frustrating. You are doing such a good job of trying again. And so we are really performing using our voice as parents of what we'd like them to internalize as their inner voice to help
Yes.
walk them through situations that might be particularly difficult in a child with ADHD.
Now that I use AI a lot and I bring to them my frustrating problems, they always start out with that. Well, this must be so frustrating for you. I can understand and blah, blah. But it is so helpful to feel that. And the other way I'm thinking this is helpful when the parent talks like that way is often children do not understand their own emotions. And so if the
Right.
parent is saying it looks like you're frustrated, the child can start thinking, oh, when I feel this way, the word for that is frustrated. I
Yes.
don't know if you're kind of,
Absolutely.
but that's what I'm hearing. Yeah.
Yes. So we call it emotion validation and emotion labeling. And the more that we can do that for kids, the
Uh-huh.
more that they pick up on it themselves. If they happen to know they're feeling an uncomfortable or icky feeling inside and they don't know exactly what it's called, getting that information can feel very relieving
Uh,
for a child too, that it
yes.
has a name. And because we're pairing it with, and you're doing such a good job of persevering, or, and I see what you're doing next, children also start to build the self confidence of, I've had this feeling before, I've been frustrated before, and I did a good job. I knew what to do, and someone was pleased with me. And so that really helps to support emotion management and building of some of those emotion regulation systems and confidence.
Yeah, it sounds really helpful. What you're talking about too is that this method is helping the child to improve their own emotions and their own
Yes.
behavior. How do you describe that happening?
Yeah, I think there are a lot of different mediating factors. PCIT on its own has been shown to improve behavior and symptoms in ADHD. But there are also modifications to PCIT that have been added that specifically include emotion coaching as well. So there are some direct emotion coaching approaches, but PCIT on its own really helps with some of that emotion regulation in a number of different ways. Number one, we're having the parent model what an appropriate way of interacting with frustrations and everyday challenges might be. So the child is being able to watch because the parent has us in their ear, being able to help them show breathing or show a different strategy to stay calm in the face of challenge. And also highlight what the child is doing well in the face of challenge and also decrease focus on what is hard or what is not working in the face of challenge or frustration. For example, oftentimes children with ADHD might have difficulty modulating attention on different thoughts or different stimuli.
Even I don't understand what modulating emotions means on different whatever.
Sure. Yeah, good question. So I think when I think about ADHD, sometimes people might say, or at least our verbiage says attention deficit disorder, right? But oftentimes what we actually see is that we can't focus. In fact, there might even be some superpower hyper focus involved. What is often the challenge is changing and shifting how much we're focusing on one thing versus another.
Are you talking about the transitions or
Sometimes transitions, but also if I'm a kid and I have ADHD and I'm in a noisy room, I might have difficulty figuring out or naturally figuring out what information I can phase out and not pay as much attention to and what information I need to funnel more of my resources to. So that's a difficulty in modulating attention, figuring out how much of it to put in different places at any given time. And so, because that is a challenge for a lot of kids with ADHD, that can also be a challenge when managing emotions. If I am really frustrated about something, or I'm having a big anger feeling or a big disappointment feeling, I might have difficulty figuring out how much energy to put toward that versus how much energy and attention to put towards the task that I'm trying to accomplish versus the executive functioning of figuring out, I know I feel this way. I want to accomplish this. What are the steps I need to take in order to be able to get through this emotion to accomplish what I'm wanting to? For example, in my magnetile tower, all of that can be really challenging for a kid with ADHD. And what PCIT helps parents do is create kind of a scaffolding for children to be able to walk through those things. If I'm a parent and I'm being coached to give a lot of verbalization to the child, I'm trying to create number one, the acknowledgement of the emotion, like we were just talking about. You're feeling frustrated. I can see you want to build this tower. And then we help walk them through the steps to be able to get there. And that's what can feel so successful for a child is being able to have the really intense, challenging emotion regulation, have the
mm,
parent focus on what the child might want to focus on in order to move through this process and also have the parent not put a lot of attention towards the things that might stop the child from being able to accomplish their goal.
I just need clarity
Yes.
here. So,
Yeah.
is the parent kind of teaching the child how to handle this moment and get through it in a good way? Is that what you're talking?
That's one of the effects of PCIT is that there's a lot of modeling through what it should look like, but we don't necessarily do that through explicit teaching. If a child is having an emotional moment, they're probably not going to be receptive to us telling them or
Okay,
teaching them
so
what to do.
how do the parents co-regulate? What do they do to co-regulate with their child?
Yes. So, one of the things that we really talk about is trying to focus on praising positive opposites. So, if our child is kicking and frustrated and knocking down their tower,
Uh,
and then they take a breath and stop, the thing that we're focused on is taking the breath and stopping. And we are not putting our attention or verbiage or language towards some of these things that aren't as helpful for the child moving through these emotions. So we're also showing the child what to pay attention to. The parents themselves are modeling calm, regulation, describing what they do want to see more of for the child and what's helping the child, and really praising and reflecting what the child is doing well, even if they're happening in little tiny snippets of moments in the interaction.
This is not one of my regular questions, but I'm just curious,
Sure.
how do the parents react to, like, stage fright because you're there watching them? And how comfortable are they with this process?
You know what I think is one of the best things about PCIT, one of my favorite things is that, first of all, the parents we work with are amazing. They definitely show up with a level of vulnerability and authenticity, allowing us in their homes in their most challenging moments. Absolutely. Give them all the credit in the world. Oftentimes during the first session, our only goal is for them to get used to us chit chatting in their ear while they're trying to attend to their child at the same time. So there's at least a session of very low pressure, not needing to meet any sort of goals or benchmarks. Together, then in PCIT, we're really working towards specific skills benchmarks. So that's like frequencies of some of the skills that we teach within a short period of time that we code. And that because we have that shared goal, parents aren't necessarily feeling like I need to either do this well or it hasn't gone well. There's really more of a measure that we follow of
Skill
working
building.
towards the same goals together. Yeah.
Huh. So, what's something that parents often do, even with good intentions, that could make things go south, get worse? Not necessarily when
Reiterate.
they're doing PCIT, but just parents in general. What are some of the things that when they think, "Oh, this is good, or this is gonna help," and it doesn't?
And often with good intentions. I think we're all trying our best and we are all figuring out what to throw at the wall and see what sticks. One of the most ineffective but well intentioned things that I see parents do is telling kids to focus or telling kids to pay attention or using a command to try to gain attention. If it works, it often works for tiny increments. And it does create some frustration because if you ask anyone to do anything and then they don't do it, whether it's because they have the capacity to or not, it creates an inner tension and a parent can easily feel disrespected if that happens. Whereas if we pull out the command altogether, if we use other skills to be able to inform and influence behavior and attention, both the parent and child are have a warmer and more connected relationship and actually get closer to the goals that they're looking for. Another is the no, stop, don't quit, not family of communications or verbalization. Stop that. Don't do that.
Oh,
Quit running. We find that these are like negative talk. They tend to reduce a child's confidence. And because we don't tell a child what to do, it really doesn't set the child up for success, especially a child who has ADHD or executive functioning challenges. So the way that I describe it is that if you tell a child to stop running, the most recent word they've heard is running. And oftentimes you'll see they continue to do that most recent word. In order for them to stop running, they would need to want to stop running to have the motivation, inhibit the action of running, which is an executive function, come up with a better thing to do instead. So planning and organizing, and then initiate doing that thing and seeing whether or not it's the right thing. So instead of telling a child to stop, quit, or not, one of the main skills that we teach is helping them understand what to do. So instead of stop running, please use your walking feet. Lets a child know exactly what they need to do in order to have accomplished the goal that they're
yeah.
setting out to do.
Uh-huh. Hmm. All right. Sounds good. So, how can parents set clear expectations without triggering shame or shutdown? How can they set up the expectations so the child feels enabled instead of disempowered?
I think neutral talk is one of the best and most powerful tools to use. Instead of saying, you need to sit down and do your homework, we might use some more neutral talk around saying, it's time for homework. After homework is done, I have a snack ready for you. And
Mhm.
when I see that your homework is complete, I'll put the snack in front of you. So a lot more I language than you language and a lot more neutral talk, I think helps to set the expectation, let a child know what's going to happen now, later. And then the in between is really up to the child to decide if they want to do, because we can't force a child necessarily to do any of these things.
So, it's often do this and there's some kind of reward later.
Not even necessarily. So that, right, do this is a little bit of a command. It's more of setting through what the expectations are without telling a child they need to, without there necessarily being a harsh consequence if they don't. And not necessarily, I think I brought up this snack not as a reward, but just as a communication of when you finish, this is our next step. This is the next step in our sequence.
So, what I found most helpful when raising my children was to have some family rules. So, though people don't like that word of rules, but house rules that everyone had
Mhm.
to obey, all five of us, which was not taking other people's possessions without permission. I can't even remember them now. How would you respond to that?
So PCIT, we work up to it. It's not one of the first things that we talk
Uh,
about, but
uh-huh.
PCIT standard protocol, we work up to including house rules towards the end of the protocol. The reason why we put it towards the end is because we find that for really impulsive kids or kids who are having a hard time
Yeah.
following any kind of direction or any kind of house rule, we really want to increase their confidence and also increase parenting skills before we get to the goal of a house rule, which is really a higher level of difficulty because we need to be thinking about it all the time and monitoring ourselves and our actions all the time. And so we get there, it's just towards the end of PCIT. And when we do, it's more about thinking through exactly what you're talking about, the ones that everyone has to follow, the behaviors that wouldn't be acceptable in any kind of situation, and how to get consistent consequences and follow up from your parents so that if this happens, this is what I will get. And I think that's particularly important for kids with ADHD, some of whom might have exceptional pattern recognition. If you set forth a rule and you don't always follow through with it, you can bet your kid with ADHD is going to pick up on that real fast. And so that consistency is also a real feature in PCIT that we put forth in order to help.
The hardest part for me with my children is I had a rule that they had to have their seatbelts on and not be fighting, or I would stop the car. And I
Mhm.
would stop the car. It's so hard for me to stop the car because I have ADHD and didn't like stopping whatever I was doing. But I learned in my own training when you have behavior modification, if you're not consistent, you really make it worse.
And I think you bring up a good point, which is particularly for kids with ADHD who might be chasing a little bit of dopamine sometimes, depending on the child. Any kind of shift or change in expectation can create a little bit of a jolt or an interest and be reinforcing. And so that consistency also makes it a little bit more boring to break the rules and more exciting to do something else that gets you some praise.
Yes, yes. I have one son who would, if the other son was watching TV and everything was quiet, he would walk by and hit him on the head just to make something happening.
Yep,
So just
that's
be aware
exactly
of
right.
that aspect. I don't see that with girls as much. I don't know because I only had 3 sons, but I don't envision girls doing that kind of thing.
Think equal opportunity. I think girls do it in their own relational way many
Yes,
times. And I think in
yes,
particular,
provoke
if there are
things.
sisters in the house and there are multiple female identifying kids in the house, that maybe it's not as much whapping, but it's some snatching or some
Telling on
borrowing
someone.
without permission.
So, if a parent was going to start using PCIT strategies today, what would you recommend and what would it look like in real life? How would they get started?
That's a great question. So, certainly you can find a PCIT certified therapist through a number of different organizations. I'll send you the links to them that have the certified provider map. But if you wanted to get started with just PCIT skills and learning more about what those look like, there are two free resources that I think any parent can access. And I'll send you those links as well, Cynthia. But the first one is pocketpcit.com. It is a research study out of Florida where they are offering PCIT skills virtually to any
Huh,
parent who signs up.
huh.
So that's a great way to get the first half of skills for free without needing to do any additional work. The other great resource that I love is out of UC Davis, and it's called the PC Care Learning Center. It goes through a lot of the same specific strategies that PCIT teaches and helps you go through problem by problem. If you're noticing for your child, what types of strategies would I use for this kind of behavior? Or what types of approaches might I use for this particular challenge? And so I like the website because it gives you PCIT specific skills geared towards specific challenges that you might be noticing.
And that's something that's just available as a free resource for parents?
That's right. So UC Davis developed PC Care, which is a shorter form version basically of PCIT. It's
Yeah.
adapted a little bit. They have a really huge grant that has allowed them to be able to develop this resource freely for parents to use. I'll add there for a moment. But if parents are interested more in what PCIT looks like, some of the nitty gritty of what it would be like for you as a parent to engage, I also host a monthly free webinar for parents. I'll send you some links to that as well that parents can come to and learn more about what actually PCIT looks like from start to finish, too.
If they search for it on YouTube, are there any YouTubes there? Or I always shy away from social media if I'm not confident on what it is without vetting it. But are there
Right. Is there social media about PCIT, do you mean?
yeah, I
I
do.
think individual providers have put forth a couple of videos here and there, but I don't know a specific one specific resource to guide you to or to guide families to learn more about that from start to finish.
So if you had to more simply, you'd say your thing is the connection first. That's what I read.
Yes, so we focus a lot more on connection first. One thing that any family can start to do today is that PCIT really focuses on spending 5 uninterrupted minutes with your child in playtime each day. We think about it as like a mental health vitamin for your child to create a base level of connection and engagement. During those 5 minutes, we try really hard not to ask questions. We try really hard not to give any kind of criticisms, and we try really hard not to give any commands. And we find that if parents are doing this more regularly, children can come to expect that within those 5 minutes, they know exactly what's going to happen. Parents can come to expect that within those 5 minutes, they can have some more easy engagement with their child if things have been challenging. And that as parents practice it more, they're more likely to use those same kinds of communication strategies outside of those 5 minutes as well. So that's one thing that parents can start with too right away. It's just 5 dedicated, uninterrupted minutes of playtime with their child, trying to avoid questions, commands, or criticism.
That sounds like a simple first step that most people could say, I could do that. I can do that.
Yes.
Yeah. And so do you have any advice from what you learned working with parents on why you think it's important for girls to get diagnosed soon and to get the support soon? What do you see happening when that isn't in place?
Right. So we know girls are underdiagnosed. We know they present differently. We know that they're not getting quite the same school complaints home as early as boys with ADHD do. And so oftentimes what parents are noticing at home with girls is that it's harder. Things just seem harder than they ought to try to get through the day, to try to get through routines, to try to move from one thing to another. But without having a name for it or without having a treatment for it, I think parents are doing exactly what we talked about before, which is throwing everything against the wall to see what sticks, getting frustrated about it. Their child getting frustrated about it. They're having ongoing negative feedback loops happening within the family. And if we're able to, I think the data suggests that it's 3 to 5 years, if ever, to get an ADHD diagnosis from first complaint to actual diagnosis. And that's a lot of developmental time that girls are learning about themselves. They're learning about what they can feel confident about. And parents are also learning about their child and creating internal narratives about what's going on. And so the earlier that we can get a diagnosis and get treatment and find that a lot of these things that seemed to be behavioral challenges might be more ADHD related, executive functioning related, attention related, and for a lot of kids with ADHD, sensory related, then we can provide the kinds of supports and accommodations needed to achieve the pro-social behavior that kids need in order to feel successful in school. I know that you focus on kids under 8, and I think that's so important because we know that in 3rd grade, the academics get harder and the expectation to sit at your desk and sustain attention becomes more challenging. And so this period of time is really important for kids to
Right.
develop an understanding of who they are and what they're capable of, and for parents to understand that for kids too. And we know that girls with ADHD can accomplish so much with the right supports in place.
So what you bring up is that it's very hard when the culture thinks that ADHD is a certain way, which is the image of the boys. And so I think your message to parents is that if you just are feeling life is difficult with your daughter, that's enough of a clue to go explore. And at our website, we have a checklist that helps you to explore whether ADHD could be one of the things you should be really considering. The other thing you bring up, Sabrina, which I never really thought about, is that the girl is developing her own image of herself in those years that she misses out on a diagnosis. But I didn't think about how the parents are developing a story about their daughter too. And so when things improve, they both are changing.
Yes, absolutely. And you bring up such a great point, Cynthia, that the parents are developing this image of their child at the same time as they're developing an image of themselves as effective parents.
Ah,
And so, really, it's a parallel process of finding success, both in their conception of their child, but also in their ability to be the parent that child needs in order to find success.
I guess because our organization is very supportive of children taking the medication for
Mhm.
ADHD. And I think when you say that, sometimes parents feel like I'm going to prove I'm a good enough parent that I don't need my child to take medication. And I feel like that is really putting them under too much pressure because we know a child that has medication on board, it helps their brain function so much better.
And I think PCIT is particularly helpful in that vein. So there are a lot of families who come, maybe the child is too young to receive a formal ADHD diagnosis.
Yeah.
And we know that the CDC and the American Academy of Pediatrics recommends parent management training. PCIT is the most robust under that umbrella and family of trainings. So families are able to get some support and behavior change while they're considering medication or while they're waiting for diagnostic clarity. There are also families who come in to try to learn how much can be shifted through behavior and parent accommodation
Right.
versus medication. And my other, frankly, favorite way to use PCIT, or at least the way that I think it's quite successful, is when prescribers are learning what kinds of effects different medications have on children with ADHD.
Ah,
So I think in particular, some younger children where the titrations might be really fine and where providers are trying to figure out the best combination of resources, medications for children. It's great to be able to have a PCIT therapist contact your prescriber and say, this week they needed a half hour to be able to refocus on what the parent was asking them to do. And this week it happened in more like 5 minutes. I don't know what you did with the medication in between, but here is the data to help to support the behavior change and really show more nitty gritty data to the prescriber that helps them make decisions about medication as well.
and where we are as an organization, I encourage parents to learn the best things they can do, all the strategies, all the interactions. And then, if it's not enough, that's when they
Mhm.
consider medication. And they'll
That's
be
right.
confident at that point that I'm doing great as a parent. My daughter's doing as best she can, but there's still a missing piece.
That's right.
It sounds like that's where PCIT is as well.
That's exactly right. Yes. For the young kids, we are often a first line resource to understand how much can be accomplished without medication. And then for the older kids, 6 to 12, really the recommendations are concurrent treatment with both the parent management training and medication consultation, too.
I know enough about what life is if you miss the diagnosis. Do you see any sad stories that you've seen for girls that were missed?
Yeah, of course. I have a couple of kids running through my mind as we're talking about it. But while diagnoses are missed, everyone is doing the best that they can.
Right.
While they're doing the best that they can, parents are often online, learning from social media, trying tips, tricks, and hacks, and figuring out what to apply or not to apply. So there's a lot of mental load and effort that goes into it from a parent perspective of trying to figure out what's going on. At the same time, as we know, kids, girls or boys with ADHD have a higher percentage of negative social interactions in this young age range. And so while all of that is happening, I do wonder how much of it could be prevented or shifted if we had an
Uh,
earlier identification or an earlier consideration of a different way to do things for kids who present with ADHD related symptoms. And I think the really beautiful thing about PCIT and sometimes medication for patients too is the light bulb moments, the aha moments. And then it's heartbreaking when we hear, I wish I had known this before the two
uh,
years of play therapy, or I wish I had heard about this many years ago, because I think parents themselves are noticing how that trajectory might have looked different.
Sabrina, I've learned a lot today. I've enjoyed talking to you. Thank you for taking the time.
Thank you, Cynthia. It's been wonderful. Thanks for letting me talk about my favorite thing, PCIT.
All right. Bye bye.
Bye.
We believe all girls with ADHD should get a fair start in life by getting diagnosed by age 8. Visit us at www.findtheadhdgirls.org. Thank you.